So Brad Kallenbach, nice to talk to you again. Nickname's Cully.
My pleasure. Great to talk to you, James.
I wanted to start with Equanimity's mission, right? We want to give people a flavor for what we're about and what's really in our DNA. So the company's mission is to help accelerate the elimination of unnecessary suffering in the world through the scaling of the delivery of the most effective therapeutic methodologies known to science. For me, almost the most important operative word there is, or operative words is unnecessary suffering, right? How would you define that for people? Or how would you define that for yourself?
Sure, James. I think that's a great starting point. I like to think of the distinction between, we talk about in our mission statement, unnecessary suffering. I like to talk about the distinction between pain and suffering, where I say that pain is an absolute given. It's a necessity of existence. And there are various reasons for that. We all had parents who, by definition, had to fail us, despite their best intentions and all their love. This is because our needs as children are absolutely infinite and no parent can meet all our needs. We're born into the world. We already become fragmented and traumatized to greater and lesser extents. Okay. If that wasn't enough, we know that our brains are not really well adapted to happiness, peace, and equanimity in this environment, in this contemporary environment, but rather for survival in a far more different, far more dangerous environment, one where, as it's sometimes said, life was nasty, brutish, and short. Well, a great survival strategy in such an environment is to be anxious. It's to worry about the future. It's to overplan and catastrophize so that you can try and stay safe and alive. Okay. And then for good measure, there are all the other vicissitudes of life that we have to deal with. Trauma, loss, disappointment, not to mention the fact of our own mortality. This is something that the existential psychotherapists really taught us, that you don't have to have undergone any particular trauma to struggle with things like anxiety or depression or addiction. Just try being a person in the world and try do anything meaningful. And, this is enough to get you there. So in that sense, pain is an absolute given. So suffering, I would define as the unnecessary compoundment and exacerbation of pain due to a lack of insight into how to manage our minds and our emotions.
I don't think that you came up with this model, and correct me if I'm wrong, but I do think you codified it in a way that is quite unique to you. And that is, and correct me if I'm stating it wrong, but it's the emotional regulatory framework that you once, like we were having coffee for once and I was dealing with some shit or whatever it is, and you drew this thing on a triangle in the first way, and it kind of summarized basically all the ways we're able to essentially regulate our state. Well, not really regulate our state, but how our states are effective and how we can regulate it. And I think It would be good. Maybe we can get our editor to do a to superimpose sort of the image here so people can see what we're talking about. But maybe just walk us through your model of kind of how to sort of maybe treat unnecessary suffering by your own definition.
Be happy to, James. So the starting point is first to reflect on emotion and what emotion is. Emotion is an ingenious system that nature gave us to guide us through our actions so that we can meet certain needs. We all have natural needs for love, needs for connection, needs for growth, meaning, contribution. These are all primal human needs. And emotions are the data. The system that gives us data is to the best way to act so that we can meet those needs. Sometimes, though, the emotions can be uncomfortable. They can be distressing, like a little bit of anxiety, a little bit of sadness, or a little bit of frustration or anger. Now, something happens when we don't know how to manage or regulate that discomfort. We compound the discomfort and we interfere with this natural process that nature has given us to move forward and meet our needs. And so what I like to say with this model is that the purpose of learning emotion regulation or cultivating emotional fitness is not so that you can eradicate distressing emotions or emotional pain, because that's necessary. It's a given. The purpose is to get good at feeling bad. You're going to feel bad irrespective of what you do in life, but you can get more skillful. You can get better at feeling bad.
This is something that I've only personally internalized very, very recently. And as you know, I've become obsessed with Kapil Gupta and reading all of his things. And he's got this thing where he talks about dealing with anxiety. And again, it's like very difficult to articulate these things in words until you really kind of understand it on a visceral level. But he talks about like how you get over anxiety. You go into the anxiety. And like people will misinterpret that in a big way, like watch the anxiety, deal with the anxiety. It's like how I've managed to actually understand how that works is like you were saying, the emotions, it's information. It's saying, hey, I need you to look at something. And I think that the challenge, and sorry to cut you off, you could pick up on this thread, but I think that the challenge we all have is that because when you get the emotion, it's so distressing, right? It's difficult to clearly see what the information is. And so you can exacerbate it in other like weird, screwed up ways. But Absolutely. Whereas if you are able to start regulating yourself, in which you're saying like become better at dealing with the pain, you can draw the distinction between, yes, like you can separate the signal from the noise, basically.
Absolutely. And I love that description, the signal and the noise. In the language of our framework, we would talk about primary and secondary emotion. So the signal is the primary emotion. It's anxiety. It's my body telling me that I need to prepare for something. I need to get ready for something. And that's good and that's healthy. It's going to guide me. But then the noise it's something that my mind does. And what my mind does is it starts to tell a story about the anxiety. It starts to impose concepts and ideas on the anxiety, like this anxiety is really bad, or something terrible is going to happen, or this pounding in my chest means that something bad is going to happen.
It's because of somebody else. Somebody else is giving, it's their problem. It's them. They're the ones who are making me feel this way, as opposed to this is pointing something to inside of me that I need to change. And you project it on, you project the emotion that's trying to tell you something onto something else, and it leads you down a rabbit hole, and you're not solving the problem. Yeah.
Absolutely, 100%. Yeah. So with your example, then I get caught up in a story of blame, for example. So I'm doing all of these things, but the one thing I'm not doing is being present and listening to the original signal. I'm caught up in this noise. And what that noise does is it creates something called secondary emotion. So there is anxiety, which is not a problem. The body knows what to do with anxiety, just to keep using the example of anxiety. The body knows what to do with it. It's intelligent. It's got a system that is millions of years old. It knows how to regulate it. But the mind interferes. And when that happens, we experience anxiety about our anxiety. Now we're not just anxious. We're anxious that we're anxious. We're angry that we're anxious. And we might even, and here's a tricky one for all of us, for most of us, we're ashamed that we're anxious. We heap all these secondary emotions and concepts onto our primary experience, which is just trying to help us. And when that happens, the intensity and the duration of the emotion is aggravated. So we actually have a great deal more freedom over our feelings than we realize. As I say, we cannot choose when we feel an emotion, because your nervous system is sensitized and responsive to life. It's healthy to feel, but we have some agency over how long and how deep we go into that emotion. And the thing that modulates that intensity and the duration is this set of skills that we would call emotion regulation, emotional fitness, emotional agility, those sorts of things.
So before we go into the framework, I just want to draw a very important distinction that I actually just thinking about for myself. I was thinking about this while I was writing the other day. It's that the root word of emotions are to move. You have a sensation, and it is literally designed to get you to move, right? It's like, hey, here's a signal, something's wrong. It's just you've said the things like, how long or how deeply you go into the emotion, but I think even just as importantly, or even more importantly, is to get the signal. And then it's almost a necessity to first calm yourself down and get equanimity prior to moving. And the reason for that is because the mind gets involved and there's all this noise amongst the signal, is that you can just make bad decisions. So your body's doing the right thing to say, hey, this is fucked up. You have to look at this. But our reactivity gets us into more trouble, because we first need to calm down and again, like, interpret the signal through the noise. And that is, so I think, one, to just like not suffer any more than you need to. If there's no real problem to solve, maybe it's just something that's irking you or whatever. But two, if there is a real problem to solve, to calm yourself down and get at the root cause of the problem, as opposed to like going on a wild goose chase trying to deal with something else.
Absolutely. That's really well put. And you used a crucial word there, James. You said reactivity. And what this really is about, it's about the difference between being responsive or responsible, being able to respond to circumstance rather than act out and react. And the space between being responsive and reactive is the bridge between those two is this emotional agility or emotion regulation.
So let's get into it. And the one thing that I really like to say, and this isn't from me, a lot of people talk about this. It's like, especially in our generation growing up and people before us, it's like you get given this brain. It's, evolved over billions of years, and no one teaches you how to fucking deal with this thing, right? Like, and there is really good science behind this stuff now, right? So let's get into it. How can we use the tools of science to help us separate the signal from the noise? Go ahead.
Absolutely. So the first thing we need to appreciate is that an emotion, an experience, is actually something we construct to some extent in real time. Emotions don't just happen to us. There's something we do with certain components of our experience that construct these, that run these patterns. And so the first thing we have to appreciate before we can know how to regulate our emotion, how to down-regulate from intense, overwhelming anxiety that's hindering my capacity to take constructive action into healthy, normal anxiety, we need to first appreciate that there are three components to every emotional experience. That's the starting point. There are only three things happening when you and I are having an experience. And that experience could be positive emotion, it could be equanimity, love, joy, excitement, gratitude, or it could be a painful experience. It could be grief, sadness, anxiety, fear, anger, shame, even boredom, procrastination. All of these states can be broken down into fundamental components. And the one thing that happens when you're in a state is you're having a cognitive experience. Your mind is working. You're having thoughts about this experience. That's the one thing that happens. And there are different patterns of thinking that go with different experiences. So if I'm incredibly anxious, it's highly likely that my thinking is going to be future-oriented. I'm thinking, what if this happens? What if that happens? I'm running scenarios to prepare. If I'm sad, my thinking is generally past-oriented. I'm ruminating. I'm reflecting on loss. I'm reflecting on perhaps the loss of a person, loss of an opportunity, the loss of an aspect of myself, very much a past-oriented cognitive pattern. If I'm angry, I'm intensely focused on how there is some injustice in the world. Something's not fair. Someone's being taken advantage of. Perhaps maybe it's me, maybe it's someone else. And not just that, but they're doing it with intent. They're doing it on purpose.
Well, because that's so interesting. So I've never heard people link those three, they're almost primary emotions or primary negative emotions to past, present, future like that. It's very interesting. I think I've obviously heard about anxiety being a future-oriented one, but I don't think I've ever heard of anger, and I might be drawing a conclusion here, but are you saying anger is more of a present emotion? Something's happened now and you're pissed now.
Well, in part, we'd say it's present-focused, but there is a future-oriented component to it and a past-oriented component, because what inevitably happens is that you start projecting scenarios into the future. You start imagining, perhaps in the form of revenge fantasies, or you're reminded of, this is just like that time when, this is exactly the same. Then I get even more angry. So I'm not really present when I'm locked up in these states. So the cognitive component is one aspect of the experience. The most obvious aspect of the experience is visceral, physical. Emotions are physical. They're not abstract intellectual experiences. They're physical. We feel them in our body. And each emotion goes hand in hand with a host of physical sensations, what's sometimes referred to as interoception, your internal perceptions. So if I'm anxious, very often my heart is pounding, or I have butterflies in my tummy, or my fingers are tingling, or I'm feeling warm, I'm feeling hot, or cold for that matter. If I'm overwhelmed with love, my heart might also be pounding. I might also feel butterflies in my tummy. So it's very interesting. Apparently, there are good butterflies and bad butterflies. And it'll be an interesting question when we get there as to what changes the experience from good to bad, because the body can't distinguish. Butterflies are butterflies, but sometimes they feel good and sometimes they feel bad, like scorpions. And there's something going on there that we have some agency over that can shift the experience from one to the other. And we'll talk about that. But physical sensations are the other key component. And of course, the third component, which is the less obvious one, the component that we're less inclined to think of naturally, is movement and behavior. When we're having an experience, we are moving in certain ways. So we're doing something with our bodies. We're sitting in certain ways. We're pulling certain facial expressions. We're tensing up and loosening some parts of the body. Our posture might be up or slouched. We might be very still, or we might be very jittery and active. So there's movement, but there's also behavior, which I would define as a set of movements combined in a goal-directed way. So, and this is me trying, despite the noise of the signal that I'm getting, it's me trying to go forward and meet my need. So those are the three components. And in the same way that there are certain patterns of thinking and sensation that go with certain emotions, there are also patterns of movement that go with certain emotions. If I'm depressed, if I'm low, my movements are slow, they're lethargic, they're heavy. My posture is very often slouched. I have poor eye contact. My breathing is shallow. If I'm feeling excited, my shoulders are back, my head is up, I'm breathing deep. So these movements will vary. There's a lot of variance from person to person. I don't want to give you the sense that there's a common set of movements that applies to everyone. One thing we've learned about emotion is that there's a huge amount of variance in how we actually express emotion. In a nutshell, the first thing we have to appreciate is that emotion consists of those three components. And if you can, as a first step, when you're in a state, if you can break your experience down into those three bubbles, into those three components, you are already 50% of the way to regulating that experience, because you've gained awareness. You've pulled back from the experience, and you're already in an observer mode, in a witnessing mode, a more responsive, non-reactive mode. And it's just like you're curiously observing what's happening in each of those bubbles. It's like, oh, isn't that interesting? Now my heart is doing this. Now my fingers are doing this. Look how I'm breathing all of a sudden. Curious. That's interesting. Look where my thoughts are going all of a sudden. All of a sudden, I'm conjuring up memories from this experience or that event, or I'm thinking about imagining something in the future, and I just watch, I just notice, and I try to do this without judgment. That would be the first step towards regulating your experience.
That provides a framework for how these things basically connect with one another and affect one another, right? Because I mean, your thoughts can create your emotions can create your behavior, and vice versa. I mean, they can move any which way around. And again, like the first time you showed me this, I'm sure we'll put it up as like a triangle, right? So they can go in either direction. The second component with it is the word intervention that you use in order to sort of break the cycle here. And how does that work?
Absolutely. So you've helped us by jumping to the second step, which is to appreciate that these components are interconnected. They're bidirectional. Each influences the other.
Absolutely.
The sensations in my body drive my thoughts, and the thoughts will do something to the sensations. How I move will impact where my mind goes, and it will also impact the sensations, and vice versa. We have to appreciate that this is a system. It's a pattern. All emotions are patterns between our thoughts, the sensations in our bodies, and how we move in that moment. The beautiful thing about a system is that you can enter a system at any point, and if you modify, even in a tiny way, a component of your experience, the whole system changes. That's the beauty of the system. So the fact that these components are all interconnected, it illustrates how and why it is that human beings spiral into pain or into what we would call suffering very, very quickly. But if you have the right levers, if you know where to intervene and how to intervene, with just a little bit of practice, you can reverse the direction of the spiral. So we can spiral up as quickly as we can spiral down. Hence, like we said, we have more freedom over our experience than we realize. Again, the freedom is not in when we feel, because there are triggers, and this is the other component of the system. We don't experience our emotions in a vacuum. We're in the world. We're in contexts where we have experiences in the world, and we feel in response to those experiences. So we can't predict when we feel, only how intensely and for how long. The fact that they're interconnected means that we can intervene using different skill sets. And this is where we draw on really powerful therapeutic modalities like cognitive behavior therapy, mindfulness-based cognitive therapy, something called dialectical behavior therapy. All these modalities are ways of intervening in the system. So we can talk about the different skill sets we use to manage our mind. What do we do with uncomfortable sensations, and what do we do with our physiology?
That's the thing. I just wanted to double click on this. You have this emotional regulation framework, or basically how we experience anything is through behavior, emotions, and physical and cognitive sensations, right? We then have, and now you can be creating those experiences yourself just with nothing happening, but more often than not, as in life, you get triggered, a shitty event happens, let's talk about the negative side of things, and the system gets kicked off, right? That's basically where we're at. And then some of the interventions you just spoke about, CBT, mindfulness, dialectic, and I think physical movement as well as one you left off, which is exercise. I don't know if there's others beyond that, but like exercise or just doing something physically with your body can absolutely change your state. And these are the things that you go to therapy for, at least hopefully a good therapist for, or psychiatrist, to learn how to utilize these tools into your day-to-day life, so you're better able to you're better able to respond, as you were saying, right? I think this is like a good segue into psychedelics and the framework that you've developed for equanimity, having this framework front of mind and other frameworks from your other co-founders in designing the framework. So I want to try to walk everyone through the framework, kind of in your own words, beginning to end, and just sort of talking about why psychedelics, and I hope I'm not speaking out of turn, but I think that the reason psychedelics, or one of the many reasons they may be so effective, is that there's a difference between knowing these things, like listening to this conversation and understanding what we're saying on an intellectual level, okay, cool, this makes sense and you can trust us, this is verified by science, there's good research supporting this. But it's it's one of my favorite things. It's if you want to lose weight, you eat less, you move more. It's very simple, right? But half the world's overweight and whatever. So I think that what's so exciting about psychedelics is they produce an experience for you that when you get an education like this about these various methodologies and you're in a particular set, you are more likely to actually internalize the lessons you've learned and are able to then actually implement these things, as opposed to just sort of understanding it intellectually and not getting anywhere.
Absolutely. So I think that's a really helpful segue into the framework that we've developed, and I'll take you through that. I wanted to just reflect on something you said, which is the difference between knowing and doing, or knowing and feeling. As they say, we know what to do most of the time, but we don't do what we know. Why? And that's in part because our brain has been primed and conditioned over years and years and years to react in the same way over and over and over again to different circumstances or what we might call triggers in life. So if we're thinking about our model, these interconnections between thoughts, sensations, and movement, we condition ourselves to run the same patterns over and over in response to very, very different triggers, which is why it's often said that, most of the time, no matter what happens, grateful people get grateful, angry people can get angry, calm people go calm, anxious people get anxious. That's conditioning. That's running the same patterns over and over and laying down deep, deep neural pathways in the brain. And what the psychedelic can do is it can drastically disrupt those pathways. As they say, by shutting down certain networks in the brain, when those networks are shut down, it allows distant parts of the brain to speak to one another. And then all of a sudden, you're perceiving reality in fundamentally altered ways. You're perceiving yourself in a fundamentally different way. And then that hopefully manifests in a behavior change. But of course, we can get into that as we talk about the framework.
I mean, I'm learning about this. I just sort of had an insight as well. It's so interesting because I wasn't even referring to, even though I know about it, of course, it interrupts the pattern. That's like on a neurological level, that's why they think psychedelics are so effective, is they promote this neuroplasticity and you're able to kind of break out of these destructive patterns. And the thing that I was alluding to earlier is that it also creates just a deeper understanding on an intellectual level about how these things work as well. So it's kind of like a dual benefit, right? It's like you can come on an experience with us in a beautiful set and setting, administer these substances that help you understand things that are only intellectually on a deeper level, but also just physically break the destructive patterns that you have and help craft better systems to basically dealing with your external world.
That's exactly right, James. Putting these concepts up on a whiteboard in a diagram and understanding it intellectually is one thing. When you're in a psychedelic trip, when you're in a journey, you're experiencing it in real time. So you're encouraged to actively apply the skills that we're talking about. You are compelled to try and regulate yourself. So it becomes experiential. It's as if, as neuroscientists would say, the frontal cortex goes a little bit more quiet, and you're in that limbic system, that experiential brain, and that's where rewiring happens.
Okay, cool. So let's get into it. So take us through the framework, the summary framework, and walk us through each of the sort of highlights of the components and why and the why behind including that element of the framework.
Sure, I'd be happy to, brother. So the framework is broadly divided into three phases: preparation, the journey itself, or sometimes referred to as the ceremony, and integration. In preparation, what we're doing is we're helping you prime your body and your mind to receive the plant medicine. Think of your body and your mind as a vessel. You have to clear that vessel. You have to clean that vessel so that you can adequately receive the medicine. And the first priming that we do, we work on what's known as your mindset. Mindset refers to the mental framework within which you go into a psychedelic experience. It's crucial to do the necessary preparation to prime your mind in the right ways before undergoing an experience like this, because as we know, during a psychedelic experience, you're undergoing an enormous amount of therapy in a very, very short space of time. You are drastically and radically breaking down defense mechanisms that your mind has put up over many years to keep you safe and secure. But those defenses have become too rigid. They're not serving you anymore. It's a little bit like it's stopped raining, but you're still holding an umbrella. And by still holding the umbrella without the rain, you are alienating yourself from a more intimate, connected experience of reality or to yourself. Traditional therapy disables these defense mechanisms slowly in a very gradual, safe, therapeutic way. Psychedelics does it extremely quickly in a drastic way. And this is why the conditions have to be safe, and we invest such a great deal of time in preparation and mental and physical priming. With regards to our particular program, in the preparation phase, you work with your therapist it's important to preface this, James, by saying that this is not just a 5-day retreat. This is a 6-month, deeply comprehensive mental wellness program. So the therapist that's assigned to you in the beginning will stay with you for the full 6-month experience. In preparation, you're working with your therapist on a crucial document that we refer to as your life story. Your life story is a deep psychoanalytic dive into your personal biography, where we are getting a great deal of insight into your past, into who you are, into what were the fundamental relationships that shaped who you are today. What were the traumas you experienced? What were the key transitional moments that you experienced in the narrative of your life? And we're helping you organize the narrative of your life into a coherent story. And we use those insights as a segue into setting intentions. Now, intentions are a crucial component of mindset. Intentions are the parameters. They are like the coordinates that you plug in. It's been said that traditional therapy is like attaching yourself to a sail and, gently sailing through and exploring your mind. Psychedelics can be a little bit like strapping yourself to a rocket. You're being launched somewhere, and ever more important to have clear coordinates and a sense of direction. So your intentions are a logical extension from your life story and the insights we gain through the life story process. And they are your North Star. They orient you towards a meaningful future. Like any journey, there are going to be obstacles, there are going to be bumps. The waters are going to get choppy. You're going to get thrown off course. But if you know what your true north is, if you have a compass, you can reorient yourself and realign and keep moving forward. So with intention setting, we help people get crystal clear on what it is they want to get out of the 6-month experience.
This is what's so, if there is a secret sauce to what we're doing, it's the quality of the clinicians that we're going to be working with, you included. One of the many reasons it's so important is that people may come to us with a particular, or thinking they have a particular intention. With skilled therapists, you guys can get into the meat of their narrative and their autobiography and not tell them what they want to get out of the experience, but just ask them the appropriate, insightful questions to help them better understand. It goes back to the signal from the noise. They're anxious about X, and so they think they need to solve problem Y. But after actually going through their autobiography with them, you realize that no, that's actually just symptom. It's not root cause. Maybe your intention should be more around this, right? And this is not something that can be picked up from by just any random person who hasn't had the appropriate formal training that the clinicians that are working with us do.
That's absolutely right, James. What we're doing in this preparation phase is we're forming a relationship with our participant. And this is what really distinguishes our framework, I believe, is that we invest an enormous amount of time and invest a great deal of energy into forming a deep connection with the participant. What's important about this is that, decades of scientific literature have tried to distill what the key components are that help determine a successful therapeutic outcome. And over again, the same finding shows up. It's the depth and quality of the relationship between the patient or the participant and the therapist or the guide. And this makes a great deal of sense because, as we say in psychology, damage and trauma occurs in relationship. So healing and repair occurs in relationship as well. It's in relationships where the deepest transformation and healing is going to occur. In the same way that in traditional therapy, it doesn't matter how fancy or technical or advanced your tools are. Without a relationship premised on expertise, kindness, curiosity, non-judgment, authenticity, congruence, the tools fall flat. They're not effective because the participant or the patient isn't open to receiving the tools in that sense. So we spend an enormous amount of time investing in the relationship. And this also has to do with a crucial concept called transference. Because what happens in traditional therapy is, under these conditions, of the parameters of the therapeutic relationship, when the necessary and sufficient conditions are properly set up, what happens is that the patient or the client will regress and they will begin to enact earlier patterns of relating, patterns that they played out with their parents. They will enact it onto the therapist. And that is known as transference. They transfer these early patterns of relating onto the therapist. And that's a really good thing. That is the primary action of of many forms of therapy, especially what we would call psychoanalytic therapy. And when that happens, you have a beautiful opportunity, because then the therapist is in a position to be responsive, to respond with more kindness, with more compassion, with less judgment, with more openness and receptivity, and more insight to what the patient is bringing. And that's when transformation happens. They have what's known as a corrective emotional experience. And that's literally where the brain is rewired. So it's a little bit like, I'm talking about this particular thing to my therapist, and my whole life, when I spoke about this thing with my father, or when I brought this up with my father, or we had to deal with this issue, I felt ashamed and I felt weak and I wanted to hide and I felt like I couldn't be vulnerable. Now I'm doing it with my therapist and I'm being responded to with kindness and compassion and openness and receptivity. Mm-hmm. And so I'm having this corrective emotional experience. So it's crucial that anyone who does this work has sufficient training in these sorts of therapeutic experiences and dynamics, because with insufficient training, what can happen is the therapist can begin to project aspects of themselves onto the patient without realizing it. So you begin to intrude into the space of the patient, into the psychic space of the patient, and that's counter-therapeutic. It's a little bit like you're trying to heal yourself without realizing it, because you've got unfinished business that you haven't worked on.
That was one of the most interesting things that Ant was telling me about when I was chatting to him a couple of months ago, that the training that clinical psychologists go through is actually like you get watched or filmed kind of treating other patients, and you're kind of coached. Like, did you see how you projected yourself there? Did you see how you were listing judgment there? Your eye contact was there, and you actually get taught how to kind of keep that appropriate separation to give the patient the space they need to do the healing that they need.
Absolutely, James. And in the psychedelic journey, this becomes ever more crucial, because you remember that your defense mechanisms have been completely disabled. The participant might be reliving an early trauma. They might be reenacting something from their childhood. And without that therapeutic space, the knowledge of where I end and where my patient begins, you can disrupt that experience. You can intrude on that space, and that can be counter-therapeutic. When it comes to preparation, yes, we're working on this life story, but what's more important than the content is process. It's the process of talking to a sufficiently open and receptive and non-judgmental human being. That's where the deep work of preparation really begins. So life story will give you the what, it'll give you the content. It might even give you the how. We might even start mapping out the exact steps that you need to take post the journey to begin translating and transforming your experiences into meaningful behavior change in integration. But more important is what's happening at the qualitative, the intersubjective level, the process level. So that's part of preparation.
It's also just to summarize it more simply, it's also just sharpening your axe in a way with someone who is capable of doing the sharpening. It's like we have these thoughts, we have these narratives or whatever. They may be blunt and unclear and whatever, and just to work with someone of sufficient capabilities can just help you just more better define where you want to go. So that's the autobiographical piece and the relationship with the therapist piece. But can you talk a little bit about cold exposure, breath work, yoga, and how that sort of is also built into the sort of beginning? Because there's work that takes place pre-retreat, a lot of autobiographical work, some one-on-ones with you guys and other clinicians. Then you're on retreat and you're digging into probably more of the autobiographical stuff, but then there's also these practices that you guys have incorporated into the program, and I'd just like you to talk a bit about that and what's the purpose of them.
Absolutely. So we introduce exercises and practices like breath work, meditation, and cold exposure for a very particular reason. And the reason links directly back to what we were talking about in terms of the difference between pain and suffering, or being responsive versus reactive. In all of these experiences, take cold exposure, for example, you are cast into an extremely uncomfortable state. and you're afraid. Most people have never jumped into an ice bath, but we encourage you and invite you to move into that space, into extreme discomfort, and find a way to regulate yourself, to use the skills that we've already been priming you with, how to find your breath, how to regulate your mind when it starts telling stories, what to do with your physiology.
Let's just bring it back to so the trigger is the cold, right?
Yeah.
The cognitive side is, oh, fuck, it's cold. The physical side is, oh, fuck, it's cold. And the behavioral side is, I want to get the fuck out of here.
Absolutely. Quite right, James.
Okay, so those are the automatic reactions to it, right? And so what is the practice that you sort of try to teach people to kind of deal with it, basically, and then the insights that they potentially gain as a result?
Absolutely. So the first invitation is to not resist the experience. And this goes back to what we were saying with the framework. It's about observing with curiosity, with interest, with openness, even with a kind of compassion for yourself. It's like I'm in a great deal of pain, but I have compassion for myself in this moment. Instead of telling myself, running the mental pattern, I'm weak, I can't handle this, or running another mental pattern, which is, I'm going to die, or I have to get out. I need to get out. I can't cope. Those are all stories that your mind is telling you. So we teach you to step back and witness the experience with an openness, a receptivity. And when we do this, what happens is that we're able to find a sense of stillness or a center, an anchor in that discomfort. And we actually teach people to lean in and to open themselves to strange sensations, because again, when you're in the ice, when you're in the, your skin might be on fire, but if you learn how to observe those sensations, that experience is a pure bundle of raw physical sensation, just physical sensation, and you do it with curiosity and interest. What is that hot feeling on my skin? It's tingling, it's pressure, it's numbness, it's temperature. And I just observe it as such. And then the moment my mind starts telling stories, have to get out, have to get out, have to get out, I notice that without judgment. And then I bring my awareness back to simply observing raw sensations. And this makes the experience tolerable. It doesn't make it easy. It might not make it pleasant, but it makes it bearable.
It's just, it goes back to the things of knowing things intellectually versus experiencing them viscerally. And back to how one would define unnecessary suffering, which is the cold is cold and it sucks, but your mind can make it so much worse. And that's the unnecessary suffering part that we're trying to teach ourselves, teach everyone else about, like how to regulate that piece of it. It's a really cool practice to kind of drive home. Again, it's really just well thought out about the whole emotional regulatory framework, and you're using a objectively non-dangerous but highly visceral practice to help people experience it viscerally and not just intellectually, not just looking at it on a board.
Absolutely, James. We're performing what we would call in psychology an exposure. Instead of waiting to be triggered by life, waiting for something stressful to happen, because it's guaranteed. Just set your watch. Something stressful is going to happen. Instead of waiting for it to happen, move towards the stress a little bit each day and build what we refer to as that emotional fitness, that capacity to tolerate discomfort. And that is going to be absolutely crucial during your psychedelic trip or your journey, because you are going to have many moments possibly in that journey where you could be afraid, you could become frightened, you could start breathing quickly, you could get a fright. And having survived the cold, learned how to find your breath, you'll be able to apply the same skill in real time when you need it in the journey. And the beautiful thing that happens when you see people having these experiences is that they build courage. Courage being the capacity to move forward despite fear, despite anxiety, rather than the absence of it.
It's one of my favorite Jordan Peterson quotes. I might butcher it, but it's not that. And also, I think this really is just sort of another underline of just what the company is about, is that I don't think we're not selling anybody a bag of goods that, oh, once you come through this, your life's going to be perfect and everything will be great. I mean, Buddha was right. Life is suffering. It's incredibly difficult. We all know we're going to die one day. But the beautiful thing about it as well, the flip side of it is, it's not that life gets any easier, but it's that you're a lot stronger than you think you are. Yeah, and by doing these things like cold exposure and psychedelic journeys, they can be very harrowing and trying and difficult, but more often than not, and especially if done in the right set and setting with the appropriate professionals, you can come out of those harrowing experiences just a lot stronger and better equipped to deal with the challenges of life.
Absolutely, James. I mean, trying to rid life of stressful triggers it's an impossible project. We can it's
a direct route to unnecessary suffering. You'll be constantly pissed every time something shitty happens and you can't deal with it.
Absolutely, James. So this is one of the reasons we introduce these sorts of practices. We're teaching you how to go inside and find a still center, irrespective of what circumstance or what environment you're in, externally or internally.
And so just to touch very briefly on the breathwork side of things, because that doesn't actually expose you to anything sort of trying, but it does give you a visceral experience. And I've done a lot of this work myself. It does give you a visceral experience of how capable you are of regulating your state without having to take a drug or, a psychedelic or anything. You can kind of just do this breathing and within 15 minutes recognize how much calmer you are. And I don't want to put words in your mouth, but I assume that's why that's part of the program as well.
Absolutely. So in part, we train people how to breathe and how to regulate their breath, in part to teach them to voluntarily release endorphins and to release a neurotransmitter called GABA, which is it's like an anti-anxiety cocktail, a calming neurotransmitter. There are also breathwork patterns that we expose people to that actually switch on adrenaline and cortisol, that actually elevates what's known as the sympathetic nervous system, which is the fight-flight response. And that's really useful because what we're teaching people to do is to switch on stress when they need it so they can use it. Short-term stress is a really good thing. It's the only thing that really compels us to move and to do anything. We need stress in the short term. What we don't want is chronic or long-term stress. But if you know how to flex a muscle, if you can switch on short-term stress, you can practice regulating yourself. You can practice switching on what's known as the parasympathetic nervous system, the rest and recovery system. So again, creating that agility, that flexibility, empowering people, helping them realize that they have a great deal more agency over their brain than they've felt up until now. The other components of the breath of these practices like cold exposure and the breath work that's crucial is this concept of non-resistance. It's learning to let go, to stop trying to control everything. And this is back to the distinction between suffering and unnecessary suffering. We create unnecessary suffering when we try and over-control. And this is very pertinent to the psychedelic trip. As we say, there really isn't, strictly speaking, there might not be such a thing as a bad trip. What creates difficult experiences internally is resistance. It's trying to control the experience. But if you've practiced breathing exercises where you breathe, you do something called holotropic breath work, which is you breathe really rapidly, really quickly for an extended period of time, you start to feel afraid because your body starts tingling, your head starts to feel fuzzy, you're having all these reactions that are unfamiliar to you, and you start to get anxious. And if you can find a way to let go and to not resist and to just keep going, you'll break through that fear. And it's the same with the cold exposure and even meditation. And crucially as well, yoga. Now, yoga, we're talking about moving meditation in that sense, putting your body in difficult, uncomfortable postures and finding a way to lean in and breathe in and not resist and tense up in those experiences.
It's so cool, man. I mean, this is why it's so cool to be a part of it in some small way, because it's like, it's almost how school should be developed, where it's like, because you are going to have, just also to be clear, like you are going to have these subject matters that we're talking about. You'll have these workshops with the clients as well, right? Where you'll draw out the emotional regulatory framework, and there'll be a theory component to it, explaining to people first intellectually how all these things work. And then there's not just one, but like a whole bunch of practices where there's, again, that ability to internalize. And the other reason I think that's so beneficial is because people are naturally inclined to learn in particular ways. So some will be verbal learners, some will be written learners, and some will hate yoga. And it's okay. You don't have to like yoga, but maybe you'll like breath work, maybe you'll like cold exposure. And it just gives us more of a chance of actually getting people to sort of internalize the lessons based on whatever they're naturally drawn towards.
That's exactly right, James. And we take an incredibly bespoke approach with these tools. We don't throw everything at everyone all the time. We learn, and this goes back to forming a relationship and really getting to know our participants and working on the life story based on their past experiences and their intentions, where they want to go. We tailor the journey. We recommend specific practices. For one person, more breath work will be more appropriate than more cold exposure. For another person, meditation is really where it's at. So we take this incredibly tailor-made, bespoke approach, creating this very highly idiosyncratic journey for each of our participants.
You know, it's so interesting how the core business is a psychedelic business, if you had to just sort of sum it down, and yet psychedelics are not in our mission statement at all. And just even this interview, right? It's like, because I'm about to move on to the actual journey, right? And it's just funny because it'll be the thing we speak least about because it's the medicine and it's the work that takes place prior and after that is the most important. But anyway, I just thought it's just an interesting thing, the way this is kind of evolving. Okay, cool. So there's 2 days of cold exposure, breath work. There's also, we should also make it clear that it's all done in like sort of 5-star, a beautiful, stunning setting. And also, you know, time for people to actually enjoy themselves and have fun. This shouldn't be so heavy. It should be light. It should be more definitely maybe challenging at times, but a really fun, enjoyable experience. And then 3rd day is journey day. And what does that look like?
So journey day, we take our participants to an incredibly beautiful natural space that we've carefully created. We pay a great deal of attention to the details of that space, and we position people individually, depending, again, linking back to their life story and their needs and where we feel the opportunities for growth might really be. So for example, we worked with one lady who was always cold. She was always cold, and we came to understand that part of her shivering, part of her cold, was one of the ways in which her body was expressing trauma. In this case, the trauma of loss. She had just undergone an incredibly painful loss. And on journey day, we placed her next to a heater specifically. We wanted her to be warm and comfortable and safe because, again, it's only in those conditions that we can really let go, and those defenses can drop, and we can allow our psyche to do the necessary healing work that it needs to do. So we're very careful and conscious about where we place people and how we place them. But what Journey Day looks like is we essentially, once everyone is settled in, we administer the psilocybin, and we invite people to lie down and wear eye shades, and to listen to a very carefully curated emotive music playlist that will help facilitate an emotional journey, one that starts relatively light and open, and then building into a more emotionally provocative set of tracks that will help facilitate grieving and emotional expression. And then it relaxes towards the end. You gently come down back out of the experience. And we are there as a loving and supportive presence. Sometimes what that looks like is putting a hand on someone's shoulder and just letting them know that they're safe. Sometimes what that looks like is reminding people to breathe. Sometimes it's about encouraging people to go back inside. Sometimes people can become distracted by food or by wanting to look at the beauty of nature, or becoming chatty. And those can all be ways of avoiding the deep, vulnerable work that needs to take place in that moment. So again, we're using the insights gained from the last, right from the first meeting with our participants, to guide how we facilitate this process with each person.
The intention setting, like, so you go through this autobiography, you do it through a whole bunch of dialogue, you kind of crystallize what it is the person wants to get out of the experience. How is it then kind of like crystallized for them? Do they write it down? Do they repeat it as a mantra prior to the administration of the drug? Like, how does that work?
So it's a great question, James. In the beginning of intention setting, in the preparation phase, we actually do encourage people to write. Or to speak, to voice record if they're not so fond of writing. But the framework we like to use, we find that this is a really helpful way to crystallize their initial intentions, is to say, by the end of my journey, I would like to arrive at a place where and they get to complete that sentence. And there'll be a huge amount of variation in what people come up with. And that intention is being primed over and over again, because also remember, in the 2 days where we're doing yoga and meditation and breath work, and we're giving workshops on these emotion regulation skills, we're doing an enormous amount of one-on-one continuous prep work with each of our participants. And we're priming once again over and over why they're here. And as always, as I always say, more important than what is why. So if someone says, I want to resolve, I want to forgive myself. I want to heal this internal conflict. I want to come to a place of self-forgiveness and more self-compassion. That's a beautiful starting point. But let's go deeper. Why? What will that mean? What possibilities open up for you? Because the why is what will carry you through when the process gets difficult or scary.
I also like how the statement, I would like to get to a place where I is orientated towards the destination and not a vague journey. You know, like, I want to get to the place where I have a deeper understanding of whatever, but rather I want to get to a place where I am no longer an alcoholic, right? Like, it's very, and then the why piece of it adds the emotional element to it that will probably just provide better motivation for actually moving in that direction. Okay, yeah. So, and I know you guys joke that like journey day is actually your least hectic day, because people are typically having maybe a challenging at times experience. Most of the time, the whole experience is very, very positive, even if trying. And then let's talk. And then last thing, let's talk about probably the most important part of it, which is integration. So people come down off of psilocybin. Some are tired, want to go to bed. Others want to hang out and listen to some music. They go to sleep that night. There's not much work other than to just sort of allow people to come down to earth in a calm, relaxed manner and sleep it off. And then what happens on day 4 and 5, and then post-retreat?
Absolutely. So integration is arguably the most important aspect of the whole journey, because it's in integration where we get to translate the insights, the epiphanies, the experiences we've had in the journey into meaningful and lasting behavior change. That's what it's ultimately
I want to
about.
just really emphasize that point, because one of the things, which is why I'm so motivated to be a part of a business like this, it's like scratching my own itch. It's like one of the most shitty problems with the therapeutic, the therapy profession, no offense, is like this idea that you have to sit on a couch for years of your life before you can actually get somewhere, right? Like, I've had my own sort of negative behavioral patterns, and it's like, yeah, listen, like, I know I've got a screwed up childhood, like, that's fine, but like, I just want to stop doing this. Can I just like get a result here?
Absolutely, James. Absolutely. So we invest a huge amount of time and energy into giving people concretized, structured routines and steps that they can take to start to integrate this experience and allow it to translate into behavior change. One way to think of this is, we can all, having a transcendent or mystical experience, having the beatific vision is easy. Just take a certain dosage of a certain compound in a certain environment, and you can have a beautiful transcendent experience. But as Francoise Bourzat said, who's a remarkable and highly experienced journey guide and therapist, as she said once, what good is it to see, to touch the face of God if 3 weeks later you still can't look a homeless person in the eye? What good is it to come out of this experience and to feel, not just to know intellectually, but to feel in your bones, in your body, that love is all, and kindness and compassion is the new guiding force of your life, if you can't be respectful towards your wife when you get home? And that's the gap. And unfortunately, that's the gap that we often see in certain shamanic models of psychedelic-assisted therapy or non-empirically verified models. There isn't enough attention given to this integration component where people are given a structured program to follow. Of course, it can vary. It doesn't have to be rigid, but an initial set of routines and guidelines as to what to do. So it's like, okay, I've come out of this journey and I realize that if I'm more vulnerable with people, if I'm more open to, if I take more risk and I connect a little bit deeper and I risk a little bit more vulnerability with people, I show them aspects of myself that I normally hide. These are the possibilities that open up. It's not enough to know that. It's how am I going to be vulnerable? What am I going to do differently? And with who? So perhaps I'm going to start with my father. I'm going to begin by having a set of key conversations with my dad. And that's going to be my entry point, my exposure to vulnerability. And when I do that, like we said earlier, I have these corrective emotional experiences and I learn, hang on, vulnerability is safe. I can actually be vulnerable. I won't always be hurt in response to vulnerability. And more importantly, even if I am hurt, even if I am vulnerable and I'm not met with openness and kindness and receptivity, I can cope. It doesn't unravel me. It's actually okay. I can handle it. Translating these experiences into meaningful and lasting behavior changes is really what it's all about. I mean, the whole process, the psychedelic journey is a means to an end. It's a means to behavior change. Our lives change when we do something different, not when we have an internal experience or when we think of a great idea. Can you action it? Can you actually every day in the most mundane level of your existence, can you do something different? And that's where things really get interesting. And the beautiful thing is when we do something different, we can meet some of these deeper human needs that we spoke about in the beginning.
It would be a waste of an experience, frankly, to not have a concrete plan built around getting to the intention that you had set for yourself to begin with, because just going back to the sort of science behind this, what we think that these psychedelics do is they break these negative sort of pathological patterns that we have and we're stuck in, right? So it's like you do all this work prior, you take this drug, it loosens these connections that have kept you in unnecessary suffering, and then you work with someone to have a concrete plan. That it's something that I've just experienced as I've become busier in my professional career. It's like I'm not a natural planner, but I can't get through life anymore if I don't plan, because I'm just like a leaf in the wind. It's like impossible. I literally, if it's, we were supposed to do this, to do this interview like a week ago, and you were like, oh yeah, we were supposed to do it. I was like, Brad, if it's not on my calendar, it doesn't exist. Especially for, and a plan is even more important, especially for more difficult things that you have to deal with, because it's so overwhelming that if you aren't able to just say, okay, I'm doing this at 12 o'clock every Monday, you've come up with a million excuses not to do it, right? So it's like you work with you guys and others to develop a plan, and you can then go and action that plan when your brain is most susceptible to actually just naturally building new habits and thought patterns while it's basically got this medicine still in your body to a certain extent, right?
That's exactly right, James. And the difference between approaching a program for behavior change post a carefully curated psychedelic-assisted therapy journey and approaching a plan in the absence of this process is that in the first instance, you feel the plan, you feel it in your body. It's no longer a case of I should or I know I need to. It's I do. It flows naturally. It flows organically from your being. It's the difference between knowing I need to stop smoking and feeling I need to stop smoking. And you approach the plan in a completely different way. And that's thanks in part, as you suggested, to this enormous amount of neuroplasticity that's been created in the brain, this beautiful neurological window of opportunity that the psychedelic compound has created. And now you're working with a therapist with whom you've developed a deep and trusting bond, premised on trust, on care, on compassion, on insight, on non-judgment, on curiosity, who's going to be your accountability partner. He's in your corner, or she is in your corner, and she's there with you every step of the way. And if you slip up, it's okay. We encourage, and you have someone you can go back to. And this goes back to our point about change happening in relationships. Behavior change ultimately happens in relationship, and we apply we give the same care and attention to integration as we did to the preparation phase.
We actually skipped over as well just the breaking down of the client's experience, right? So just as you work with them on the autobiography to sort of identify and uncover maybe blind spots or things that they need to go deeper in, how does that work actually, Brad? Like, they wake up on day 4, they're now going to verbally communicate to you what they experienced the day before. Have they written it the night before if they wanted to? Have they written it the day before? Haven't they written it? How does that work?
It's a great question, James. I mean, once they're beginning to come out of the psychedelic trip, as you suggested earlier, we give them a great deal of freedom as to where they want to go and what they want to do in that moment. Some people want to go and be contemplative with themselves and walk in nature and journal. Some people want to dance and celebrate because they've overcome something, they've confronted something, and they feel free. And some people want to sleep. They want to eat and they want to go to sleep. So we give people a great deal of freedom as to where they want to go, and we just move with them. We follow them wherever they need to be. The next day, we go back into our routines but we take a very gentle approach. We do very gentle yoga, gentle meditation, and then we start to begin the work of integration proper, which begins with our one-on-one sessions. So the first quote-unquote integration session is a one-on-one session with your guide. What it looks like is not too dissimilar to what dream analysis work looks like when you're doing traditional psychoanalytic therapy. Remember that what the psychedelic does is it puts your brain into a state that can be likened to a wakeful dream. You're experiencing fundamental alterations in your perception of reality. You're having auditory and visual and tactile hallucinations. You might relive memories from the past. You might see a vision of the future. You might have an experience that's just totally confusing and bizarre, and you can't make sense of it. So in the same way that we decode a dream by looking at symbolism, by understanding that the dream, the unconscious, which is what is speaking in both the dream and the psychedelic journey, speaks in metaphors. It speaks in images. This is how the mind, in its ingenuity, hands us insights, because the unconscious knows that we can't handle the direct information. So it disguises it in images and visuals and experiences and memories. We help our participants decode that. But the decoding is not a general approach. Again, the interpretations that the therapists are making as to what this might mean, or why you felt that, or why did that memory come up? Again, we're making connections. We're linking back to your life story, to all the heavy lifting we did in the preparation. We're linking these experiences back to your personal biography, but also to your intentions. And this is the difference between having a transcendent experience that, it's a little bit like staring right at the sun, and it's just beautiful and blinding and overwhelming and intense. And it's like, wow, I didn't know my mind could do that. Isn't that incredible? That maybe there are dimensions that I'm not in touch with or connected to, and this is incredible. The difference between that and what does that actually mean? Oh, it connects to my relationship to my mother. And it connects in this exact way. And now that I've made that link, something I experience what's known in therapy as catharsis. I experience an emotional release. And that's pretty much what the work starts to look like. So you're decoding this experience, like analyzing a dream almost. And then you're slowly starting to think about what are the rituals and the new routines that I'm going to have to think about when I get home to continuously integrate this experience and create, as we said, lasting behavior change.
So to put it, and this may be overly simplistic, but like you work through people to gain the insight from the transcendent experience that they've had. And then after having those insights, they can then see how that kind of pathology is driving negative behaviors, and then say, I sincerely, and this is the most important thing, people have to, you can take a horse to water, you can't make them drink. People have to sincerely want to change. And if they do, they can say, right, I now get it, I understand it viscerally, and I can now design alternative behavior patterns to replace the previously destructive ones.
Absolutely right, James. That's exactly right. And the other component to this integration work that we do on retreat, which is absolutely paramount and which is not possible when you do one-on-one journey work, and this is why I strongly always encourage the retreat model, is that sense of sharing and community that you have with the group. Because remember, you've formed connections and bonds to these people who you've been with for now 3 days. You've been through all sorts of things together, cold exposure, ice baths, you've done yoga and meditation together, you've gotten to know each other. Now you have an opportunity to share your experiences, if you want to, with a group of people who is supportive, who are curious, who are interested, and who are empathic, and who understand, who've had in their own way a similar experience. And again, the psychological literature is very clear. It shows over and over again, some of the most healing experiences that human beings can have are in groups.
Yeah. And
again, it's relationships. And so that is a very special and, if I can say, sacred component of this work.
So finally, there's, the sort of plan is set on the retreat ends, and then is it 6 follow-up one-on-one sessions with the therapist you were working on at retreat, to be there as an accountability partner, as well as just, a therapist to help you deal with the vicissitudes of life that invariably await for you when you get there. I don't know if you could talk a little bit about that.
That's exactly right, James. It's 6 months of integration work in 6 sessions, and the 6 sessions are spread over the 6 months. So we'll normally do 2 integration sessions in the month after the retreat, then 1 in the following month, then we'll take a 1-month break, and then we'll do another integration session and another. So we spread it out nicely. And as you say, we're continuing the work. We're continuing to make links and connections through the experiences that they had on their trip, back to their life story, back to their intentions. And we're continuously monitoring in the context of a therapeutic relationship. Are they changing their behavior? And we're helping them get creative as to what that could look like. Back to our early example, I want to be more vulnerable. Okay, how about you start once a day with your wife? How about each day when she comes home, you say this? And this is something you normally wouldn't say to her, but you feel it inside. But go ahead and try that every day. And let's start there and see what that feels like. And when you start freaking out and you go back to your breath, go back to the skills we taught you. And so it looks like that.
And of course, we also want to get to a data-based approach to actually measuring people's subjective levels of well-being pre and post-retreat, and getting some just good data on, that it's not just subjectively people are feeling well. I suppose it's all subjective at the end of the day, but we've got some good robust numbers to show how much this work is actually impacting people's lives. We like to say that these things are not a silver bullet, and I don't necessarily think that our framework is a silver bullet either. Some people need more work than others or whatever, or they don't accomplish what they want on the first retreat. Do you know what the healthy gap is between sort of administering these drugs? Because there's so much in the news is how safe these substances are, and they absolutely are very well tolerated, but at the same time, they do need to be spaced out. Otherwise, you just sap your various neurotransmitters. Is that right?
That's right, James. Some opinions vary on this, but to my knowledge, the best timeframes are between 3 and 4 months. If you're doing a high dosage, if you're doing a big journey, what's known as a hero dose, then between 3 to 4 months should be safe for your neurotransmitters to recharge and your brain to reboot. Because in as much as this experience is healing, it's an ordeal. You're putting your psyche through an enormous ordeal, and it's not an experience. Psychedelics should be, in my view, should be had rarely and at very high doses. So I'm talking once or twice a year, maximum 3 or 4 times, maximum 4 times a year. Even that probably too much.
It's great for the business too, right? So once you've done the 6-month integration process, you'll be ready to come back to join us for your next journey, right?
Absolutely.
All right, cool, Carls. Dude, thank you so much. This was awesome.
Thank you, James.
I think maybe just to leave off, and I might be putting you on the spot here, but like, I'd like to know your why. Like, why do this kind of work? Why with psychedelics? Outside of just your thriving private practice in South Africa.
Absolutely, it's a great question, James. I suppose it goes to something quite early for me, quite primal in a sense. I'm very grateful to say I was fortunate to grow up with loving parents. Parents who did their absolute best for me. They did everything they could to create an environment for me where I could grow and grow with love. And so from as young as I can remember, all I've really known fundamentally is love from the people that mattered most to me. Not to say that I haven't experienced setbacks and traumas. I have indeed. But that framework of love that was created from a young age, it's in a sense, it's all I know. It's instinctual, and I can't really take credit for it as to why I'm driven to help people. It flows naturally as an instinct because it is all I know. It's a little bit like breathing or eating. And so, being a therapist at this time is just so unbelievably exciting. It's like, we've been doing all this work, to use a metaphor that's often used in the space. We do all this work to try and chip away at the clay of the mind to try and help people create change. Now we happen upon a set of tools, a methodology that can effectively heat the clay of the mind and make it fluid and pliable, so that you can fundamentally help someone reconfigure their psyche in such a short space of time. It's just far too compelling not to do this work. As to the deeper question as to why I'm driven towards it, as I say, it just flows as an instinct. I can't take credit for it. It could have been otherwise.